Greetings on this Sunday afternoon for me. I'm going to be recording the critical thinking clinical reasoning section, and then Ms. Enlows will be recording the clinical reasoning tool and going over a case study with you so that you understand exactly what we're going to want when you go to clinicals. Uh, I've also posted a direct link to something from Keith R.N. called I See Dead Patients. And it's very important that you watch that. And after you watch that on the YouTube, I just want you to comment below that yes, you watched it so that I know that you did. Because it's the whole foundation of why we are changing the way we do clinicals. This is the first year we've went to clinical reasoning instead of the NANDA and focusing so much on NANDA. And I think Keith Arian does an excellent job of explaining why we support the switch and why we are doing it as well. NANDA is still very important. Use of that book will be very important, and I will be recording how to use the nursing diagnosis book as well in clinical. You still will be documenting diagnoses, you'll still be having to come up with interventions, and you'll still have to evaluate those interventions. But the important thing now is us taking data and finding relationships with that data so that when a patient comes in, that we know they're going to do one of two things. Either they're going to get better or they're going to get worse. And as a RN, you really want to be able to identify and know ahead of time those patients when you can by looking at clues that they are getting worse and knowing how to intervene and act upon those signs and symptoms that tell you that they're getting worse so that you prevent complications from occurring. So we are going to a clinical reasoning system, like I said, in clinicals, and I really think you're going to like it. At first, you may feel like it's a little overwhelming when you see the paperwork, but when you really put it all together, I think you're going to say, wow, now I understand the connection between the patho and all their labs and what I'm looking for. And um, if not, then next year we may try something different. But we really want to try this full-heartedly and have the support of students behind us because we think it's a good thing. All right, so I'm going to be discussing, let me get my face off of here. Maybe it's twirling, it's deciding. All right, so let's go to the PowerPoint, and you should download the critical thinking one. When you've downloaded the critical thinking one, you can follow along with me. I posted this with and without notes. So why focus on critical thinking at all? I mean, why do we even do it? Thinking is not a static process, though. It can change daily and even hourly. Because thinking is so dynamic and changing constantly, and because all of your nursing actions require thinking, it's important for you to understand the difference between general thinking versus critical thinking. And just a little thing here I've got, if you ever hear, give me one word that explains critical thinking, a good word to offer is reasoning, R-E-A-S-O-N-I-N-G, reasoning. We know about the 4 R's in school now. Used to be just reading, writing, and arithmetic, but now it's reading, writing, arithmetic, and reasoning. And we're actually seeing them do this at early levels. Now, if you think about where the stages of development, the developmental theory said they were not ready for reasoning at this time, abstract thought and reasoning. But we're seeing in the school age level, early school age levels, even some preschool levels, that they are trying to do this. Now, how are they doing it? Through concept mapping and some of those concepts. So when we think of critical thinking, you should think of two things. It's purposeful and it's outcome focused. It's purposeful and it's outcome focused. Now, if you were to look up the word critical thinking right now, there would be no one definition that's universally agreed upon. There are several definitions of what critical thinking constitutes. So why focus then on clinical reasoning? Well, to have the ability to think in action and know the reason as a situation changes is very important. So we want you thinking on your feet, constantly thinking in action. Hey, what if this situation changes? What if this was to happen? What if I seen the vitals do this? What if his temp did this? What if I go in there and the wound looks like this? We want you to always be thinking ahead. To focus and filter clinical data in order to recognize what's important and least important so that a problem can be identified if present. You've got to be able to judge of all the data you're getting from a patient. Hey, this is keys here. Hey, this is clues something's not going right. This other data, I don't need to worry about at this time. So you've got to learn to do that. And like I said earlier, when your patient's in the hospital, they're going to get better or they're going to get worse. And if you have clinical reasoning skills to know when your patient's getting worse and what course of action you should take to prevent them from getting worse, then that's the kind of nurse we need out there. So let's look at some scenarios so that we can figure out the difference between general thinking versus critical thinking. Scenario 1. A nursing assistant is assigned to give personal care to a patient who has had a colon resection yesterday. While she's bathing, she's thinking, well, I need to get this bath done because I've got 4 more to do, and then I'm just going to go to lunch. Usually thinking is routine or aimless, as in scenario 1, with routine and aimless thought running through your heads. This kind of thinking is not purposeful in nature. Scenario 2. You have an RN who's assigned to take care of a patient who has had a colon resection yesterday. Before she gives care, she makes a plan of care in her head. She's starting to think, okay, I'm going to be needing to check his surgical dressing. I'm going to need to check his vital signs, make sure he's not getting fever. He's not showing any signs of infection. I need to feel his skin. I need to make sure his perfusion good so that he's healing well. I need to check his IV, make sure it's doing okay before I leave. I need to be sure that he's getting up. He knows the importance of getting up to ambulate to prevent any post-op complications and more. You can see the difference in the level scenario 1 and scenario 2. Scenario 1 was an excellent example of just general thinking. Scenario 2 is an example of critical thinking, also known as what we're going to expand it to as clinical reasoning. It's very purposeful and it's solution seeking. The brain is like a muscle. The more you use it, the more capable it becomes. The more capable it becomes. And I know some of you feel like my brain is not capable of anything anymore, Miss Candler. But I promise you it is. And hang with us. It gets easier. That's my favorite saying. Hang in there. You can do it. These two scenarios illustrate the difference between regular thinking or general thinking, which was what the nursing assistant was doing, versus critical thinking, which was what the nurse was doing. This ability to think critically is key to excellent nursing practice. Another example, let me just give you my example here. Scenario 1, it's Tuesday. You're driving down the highway and these thoughts are going through your mind. And I know this don't happen to anyone. Whew, I'll sure be glad when this week's over. Boy, I have a lot to do. That critical thinking test is coming up. I'm not even sure we covered it. Oh, what about that paper? And then we've got discussion. Oh, we can't forget about Kaplan and Farm, can we? Woo, I got to work this weekend. Man, do I need a haircut. Look how bad it is looking. Do I have time to go shopping for groceries, I wonder? Woo, gee. I don't think so. But boy, I'm starving. I'm going to whip in here to Wendy's. What can I get to eat for the rest of them on the way home? Do you see how my thinking was just random and random and random? So let's take that same scenario and go to scenario 2. It's Thursday and you're taking your critical thinking test. You're completely surprised by one of the questions. Now your stomach's in a knot. You're thinking, I don't have a clue where this answer came from. I don't even believe I know that they know where it came from. I studied for hours. I don't even think she knows what she's talking about. Maybe I went to the bathroom when they were talking about this. Maybe I slept through it. Man, I've got to get myself together and think. Oh, 10 more minutes. I hate this when this happens. So you can tell we're still just randomly thinking. Let's say now it's scenario 3. Let's say it's Friday and you've had a bad week. The critical thinking test didn't go well. You were stressed out. You're worried about your paper. You finished your paper in the last minute rush. You looked ahead. Man, discussion wasn't done well. You're feeling overwhelmed. Your assignments and your commitments. And you think to yourself, I've got to get organized. So you sit down and you figure out the most important goals. And you decide to take this one step, one bite at a time. So you develop a sensible plan to reach. You get out a daily, weekly, monthly calendar and you start filling in that calendar and you stay on track. You make an appointment to talk with your advisor about what resources they have that can help you problem solve. So you can see how now we're starting to critically and reasonably think by the time we get to scenario 3. Because when you're randomly thinking like that, general thinking, a lot of times you can't think straight. Your anxiety gets high, and when your anxiety gets high, what does that do to your memory? It goes down. You can't think straight. Scenario 1 then showed us aimless thinking with ideals and images drifting through our head. Scenario 2 that I gave you showed some attempt to begin to make thinking, but you're just stuck on a lot of negative thoughts. Scenario 3, though, helps you get focused. Now you're having more deliberate thought, you're taking control, you're getting organized, and you're beginning to think critically. So the key difference between thinking generally and clinical and critical thinking is control and purpose. And that's what I hope that you have started to develop as you're organizing yourself. Control and purpose. Get away from the negative thoughts. Critical thinking is the use of those cognitive skills or strategies that increase the probability of a desirable outcome. It is purposeful, reasoned, and goal-directed. So this is just one example of critical thinking. You know, once I asked a student how she went about answering test questions, because I've seen her over there looking at them a lot, and just pondering and looking at them a lot and pondering, and she replied, "Usually I read the question carefully, and then I hem and I haw about it. I hem and I haw about it." Well, critical thinking requires reasonable reflective thinking, and it may require you to do a lot of hemming and a hawing. Another expression that describes critical thinking is aha, when you finally get it. We say aha when we suddenly realize something, when our suspicions are confirmed, when we connect something from the back of our minds that we can't fully put into words, when we have that gut feeling, the aha. Experience is suddenly gaining awareness or insight into something that we've been trying to understand. So what we hope is that you do a lot of hemming and hawing, and finally a lot of ahas. Components of critical thinking. We know we've got the left side brain thinking and the right side brain thinking, and it works differently. Your left brain is more your logical problem solving, which we hope kicks into gear. Your right brain is more your creative, your intuitive side, and preventing problems from happening side. Critical thinking includes identifying and challenging assumptions, not just, I mean, that's the way it's always been done. And how many times have you heard that? Well, that's why do y'all do it this way? That's the way it's always been done. Well, sometimes we got to challenge assumptions. Sometimes we got to think outside the box. We got to critically think that that may not be the best way. And that's where evidence-based practice comes into play. Challenging the importance of the content and context. Imagining and exploring alternatives to things. Reflective skepticism. And making good arguments. Now, that didn't mean being disrespectful. Creative thinking, critical thinking is a skill. It can be taught, and it improves with practice. So you go from novice to expert nurse over the years and years and years of teaching, and the years and years of teaching your patients, then you will get more and more comfortable with that. I've been a nurse over 30 years, and I have gained lots and lots of knowledge during that time, and lots of skills that help me improve my practice. So expert nurses use lots and lots of critical thinking. So what do you think of when you think of the characteristics of a critically thinking person? Truth-seeking, analytical, inquisitive, self-confident, open-minded, systematic, mature, creative. And these are just a few that came from one of our sources that we have here on campus. And this is even a little outdated source, 2003. Things that I think about, I think of confidence. I think of a contextual perception, someone who puts all the pieces and parts together before they make a decision, being very contextual. Flexible, someone who's intellectual, who has intuitive, initiative, who's able to reflect. So everyone has their own characteristic of someone who can critically think. What I want you to do right now is just go down that list and take a second and think about the characteristics. Think about the ones that you think you have developed well on this list right now. Think about the ones you think you need to improve upon this coming year as we start out. All right, your critical thinking exam, which is on your calendar, on your schedule, will be it will open at the end of this week, and you will have until the time it closes. Now, there will be 5 short answer, what I call short answer / essay type questions, and then there will be a case study for you to clinically reason out. So there will be questions from this content that I'm going over, 5 essay, short answer, and then the clinical reasoning case study. So one of the things I would know, hint, 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 is the 5 modes of thinking. And there is a little acronym, THINK, that helps you remember it. T stands for total recall. H stands for habits. I stands for inquiry. N stands for new ideas and creativity. And K stands for knowing how you think. Remember, it's not how smart you are that counts, it's how you are smart. Total recall. Let's go over these each one. Total recall just means remembering facts, knowing where and how to find them, and when they are needed. So it's facts. It's recalling facts. Okay. And we all know that we do that a lot when we're studying. When y'all were studying growth and development, a lot of you tried to just recall facts, and that don't get you very far in this course, because we test mostly at the application or higher level, which means we want you applying the information, not just knowing the facts. So total recall means remembering facts. Habits. Habits are thinking approaches that are repeated so often they become second nature. They result in accepted ways of doing things that work, that save time, and are necessary. People often describe things they do habitually as things I do without thinking. Now think back to nursing school when you first started. You had a long page, sometimes 1 or 2 pages when you went through health skills, that told you how to check a pulse, how to check a blood pressure. You may have done this in LPN school, and you had a checklist, and there was like 15 things on that checklist just to check a blood pressure. Well, you don't need that when you get out and you get in the real world and start checking blood pressures, because you start checking so many, it becomes habit that you don't have to have a list of 15 things to do. So it's things you do without thinking because you've done them so often. Inquiry means examining issues in depth and questioning those that may seem obvious. So you inquire about things. New ideals and creativity. Boy, some of our old nurses don't like this when we come up with change and doing things different. But this is a mode that's also special to you. It's going beyond the usual. It's the opposite end of the spectrum of that habit mode that we talked about earlier. It's the questioning of why. Is there a better way to do this? Can I be more creative when I do this? Looking at new ideals and better ways to do things. And then knowing how you think. Knowing how you think means thinking about the way you think. Are you one of those general thinkers that I talked about earlier, that your mind most of the time is rambling on and on and on and on? Or do you think about critically thinking most of the time? Are you thinking, man, I wonder what caused that? I wonder what we could do to make that better. Why are we having 10 people come back in here with CHF every month? What can we do with those patients to make treatment plans better so that they don't keep coming back in? All right, now let's look at the 5 rights of clinical reasoning. I think I would know the 5 rights of clinical reasoning. Hint, hint, hint. The right cues, the right patient, the right time, the right action, and the right reason. Let's first look at the right cues. And this is gathering of data. But it's knowing what data is relevant and what data is irrelevant. And we're going to give you case studies that have relevant data and irrelevant data, and you've got to go through there and figure out what's what. The big thing with cues is, once you have this data, is beginning to know the relationship between the data you collected and the disease process. Not knowing the right cues leads to failure to rescue when patients get in trouble. The right patient. Knowing if your patient is a potential patient for complications. Knowing that when a patient comes in and they've got a certain disease process that it sets them up, let's say they come in with sepsis. Oh, I know that septic patients can go into DIC real quick. I know that septic patients can go into ARDS. And that you look for those clues ahead of time, not when they are down the road going to ICU, but that you've caught on to those things ahead of time and done all you could to help them get better. Do they have cues to be the right patient that will go bad or will recover? And you've got to decide that. Man, this patient's giving me cues that they're the right patient, that they're going to go bad if I don't do something. Man, these patients give me cues that they're doing everything we've told them. They're recovering nicely. So I don't have to watch this patient as much. The right time. Timeliness to identify high-risk patients among many patients you care for over a shift. So it's a struggle when you've got multiple patients that you're taking care of shift after shift after shift and being able to clinically reasoning. But timelessness is important, especially when you have high-risk patients. Performing interventions in the right time frame, in the right sequence to prevent complications can sometimes even prevent death. The right action, taking the right action. Facts in a recent study, half of cardiac arrest patients show clinical signs of deteriorating 24 hours before they arrested, but they were only acted upon by half of the nurses caring for them. So that tells you right there that half of the nurses didn't clinically reason. They didn't look for those cues. They didn't act upon those cues when those cues started coming up. So if that don't scare you, it should. Lastly, the right reason. Understanding the why of everything. If you're not sure about something in clinical, you should be asking why. And you should be digging to find out why. Because the whys are so important. The faculty don't know every single why. But when we don't know a why, we find out that why. We dig in there, we look at that why for you. Or we tell you, hey, here's a good source, so you need to go look this up because I want to know why. We need to know why. So it's putting all those pieces of the puzzle together. Now, every patient's different. You can't put a square peg in a round hole. Know your patient. Know their patho. Know the relationships among them. And not all patients are textbook. So remember that. Well, I remember we learned in the textbook that this, and this is the sign of appendicitis. Well, and you may have a patient who has an appendix in a different spot than where it usually is, and they're hurting in a different area even. But it doesn't mean that it's not their appendix. So just keep that in mind. Factors that affect doing, values, beliefs, and expectations. I would know this, especially your values, beliefs, and expectations. And you need to think about each one of those as you're getting ready to critically think. When you think about values, what do you think about? When you think about values, beliefs, and expectations, what do you think about? Well, your values are something that you value, something that you hold dear. Whereas when you're thinking about your belief system, it's what you believe in, what you hold your beliefs in, your more of your religious factors. Some of us value time. Some of us value others being on time, and when they're not, it makes us mad. And expectations, you can have high expectations, you can have low expectations. And everyone is different. So know where you're at and know how that affects your doing. Values. What do you place importance on? Is it honesty, integrity? So if you have someone who came in who robbed the local bank and was shot, are you going to have a hard time taking care of them? Think about beliefs, absolute thoughts that you trust and believe in to be true. Your religion, your faiths. Expectations, again, you can have high and low, but that's what you expect of certain patients. I expect my patients to take their meds and to follow through with their treatments. So that when patients don't do the things, the same value, beliefs, and expectations you have, it can affect your doing. So you have to be very careful about biases and not letting that get in the way. Standards, laws, policies, and procedures, of course, those affect how you do. You have to follow standards of care. You have to abide by policies and procedures and the law. Independent and interdependent role functions. There's some things you can do on your own. There's other things you absolutely have to have orders for. And that's going to affect your doing. And your level of expertise in itself is going to affect how you handle situations if you're a novice versus an expert. Obstacles to high quality thinking. There are 3 of those: habits and ruts, anxiety, and age and moral development. So I'm going to talk about habits and ruts. Habits is you're not going, with habits, you're not going to the other end of the spectrum. Ruts, it's mine, I want to bear myself in it, and you're resistant to change. And with habits and ruts, you become very encouraged to what we call eat your young. Anxiety, high levels, we know decrease self-confidence. So if you're going in to take these theory tests and your anxiety's out the roof, that's decreasing your self-confidence before you even start. So a low-level anxiety, though, is good for you. It helps boost you. It helps make you get up and go. Age and moral development, the very young and the very old have obstacles to face. Most people don't reach the highest level of moral development according to Kohlberg, and that was the greatest good for the greatest number. He said most people are stuck in the people pleaser stage. Just an exercise, Jack and Jill were found. So we all know Jack and Jill, they were found in a small puddle of water. They were surrounded by pieces of broken glass. There was no blood anywhere. What happened? I'm going to give you a second to think about that. What happened? Most of us, the habit in us kicked in. Jack and Jill, we seen Jack and Jill, and what did we think? Jack and Jill went up the hill to fetch a fellow. Jack and Jill went up the hill to fetch a pail of water. Jack came down and broke his crown, and Jill came tumbling after. That's what a lot of us started thinking right off the bat. But the truth is, you would have had, if you were doing clinical reasoning already and critical thinking, you would have had to have asked me a couple of questions. You would have had to have said, who are Jack and Jill? For one thing, Jack and Jill in this scenario are goldfish, and a cat knocked the fish tank over on the floor and shattered it. So if you would have simply have asked, who's Jack and Jill, you could have got this answer. So our habits and our ruts will get us in trouble. That's where I'm trying to go with that. Your habits and ruts can get you in trouble. How did the soldier fit his big tank into the house? Well, it was a big fish tank. But most of us, again, our mind just starts going, ooh, a soldier, a tank, a soldier, a tank. And we're not thinking a big fish tank. So just be leery of habits and ruts. Critical thinking and clinical reasoning, it's more than logical thinking and problem solving. Ideally, nurses should prevent problems from happening. This can be done by the use of a nursing process, and that necessitates the use of critical thinking. So what's involved in the nursing process? These steps: nursing assessment, which is collecting of your data; nursing diagnosis, which is using the NANDA list; planning, which is coming up with outcomes and goals and interventions; implementation, which is implementation of your plan; and finally, evaluation. Now, again, for years, this program has focused on NANDA, the nursing process, and the steps of the nursing process. But you're going to find now that we do focus on that, but our big thing now is looking at clinical reasoning, the relationship between data and cues and trying to keep someone from going in trouble. Looking at the relationship between the patho, looking at the relationship between the medications they're on and the lab values, looking at the relationship between the interventions that we're going to do and how we're going to delegate them and how we're going to follow up with that, and putting all of that together. So I do hope that you find that you like clinical reasoning and that it makes you think outside the box. So why are we focusing more on clinical reasoning and less on NANDA and care planning? Watch this, it says. Now, I'm not going to pull this up, but I'm going to put a direct link to this with Keith R.N. again. I see dead patients. And he's talking about nurses using some poor judgments along the way and things that have happened. So I want you to keep that in mind. One of the things that I have permission to share with you is that We recently had someone who had to have a stent placement. Well, he got to having some chest pain a few days later, and when he went into the hospital, they drew his troponin level, and it was extremely high. Well, they got him. Some of the nurses, some of the people started freaking him out, saying, "Wayne, you're having another heart attack," and he was, very scared about that. Got him all worked up. When he finally gets to the cath lab to get recath, they explained to him, and one of the nurses did as well. One nurse, everyone else was telling me he was having a heart attack. That's because they've messed with your heart. We just stented you. We've been in there and messed with that. So, yes, it's going to make your troponin level go up. And, guys, we've got to think ahead. We've got to be thinking constantly of, is this troponin level truly up because they're having another heart attack? Is this what did they just happen to have recently in their history that could have caused that troponin level to go up? So that's where we want you to get at, to clinically reason. So again, I want you to watch this YouTube, and I want you to comment below the YouTube that you actually watched it, so that I know that you did watch it. Um, I appreciate, or you can even email me. Matter of fact, that'd probably be better. You just email me and let me know that you watched it, and just a little sentence or two about what you thought about that, because it's very important and that we start reasoning more. All right, thanks a lot. Have a good evening.